So police power is the power that states rely on to quarantine individuals. Currently, they are asking people to self-isolate. However, the state does have the authority to quarantine individuals, which is a much higher level. That's what was happening to the individuals that were on cruise ships or that were taken to military bases after being flown here from China initially. They were quarantined. That is within the scope of the police powers. Both at the federal and state level. Typically, the state has much more expansive police powers because they address the general welfare of the public. The federal government has the power to do what's necessary to protect the national security of the United States. And clearly, a contagious disease does in fact affect the national security of the country. So the challenge then is balancing emergency preparedness and response against individual and communal interests. The individual interests are things that are spelled out in our Constitution. We may require isolation and quarantine, and we may require curfews and closures. And there's been a lot of discussion over the requirement of the closures of businesses within local government's purview. How do we manage protecting individual rights while at the same time ensuring communal interests? So quarantine of individuals or groups suspected or known to be exposed to COVID is absolutely constitutional, as is isolation. It can be found within the powers, and it also can be found in case law. So there are a lot of emerging legal issues and continuing legal issues with any type of emergency situation. And again, a pandemic has unique features. A lot of these have to do with emergency powers and triage. We've probably all heard the stories of triage in Italy, where, you know, when the resources are depleted, how do you make decisions about who to care for? That leads us to what we call crisis standards of care. We've talked about social distancing. There are real concerns about privacy, and then testing, screening, and treatment all present legal challenges, particularly around things like, what if your religious beliefs are not in line with recommended treatment?